Hi, I'm Dr. Nicole Vane at Moonlight Beach Dental, and I talked in a couple of the other videos about how important it is to value the life cycle of the tooth. And I also talked about some of the hidden infections we look for on x-rays. Usually people who come into my practice are really concerned about root canals and the impact they can have on their health. And I want to go through the pathway of what a biologic root canal is, and also have patients know that that's always an option for them. You just have to be very selective about what you're asking the specialist who's going to do the root canal procedure. So this patient had been very neglectful. It was a new patient. This tooth had been broken for quite some time. And you can really see here the decay that we were up against, okay? This is actually the nerve right here. This red here shows that the nerve is already alive still. So we're not going to want to poke or prod or go into these areas. This tooth was not causing him any pain when I saw him. When we get into the tooth, you can see that this part of the nerve, which used to be red like this, has already started to die back. Okay? So I can place some medicine here and see if the tooth heals. But when we start to see situations like this, it starts to become a little unlikely. And if you look through my other videos, you can see situations where I'm able to use ozone and air abrasion to clean out the surface above the nerve without traumatizing it. In this case, the situation had gone a little too far. Now, the patient still didn't want a root canal. And so what we did is we placed some healing medication right here, cleaned all of this out, sealed it, and we ended up doing a beautiful crown for the patient in order to protect the tooth. Now, the great news was that this patient had no pain for 6 months at all. So he thought he wasn't going to need a root canal. And the problem is the tooth finally died. So you can see here where we got a beautiful seal here on the crown, the nerve that's right here that was touching in the previous picture I showed you, where it's all well sealed in. We got 6 months. Quite honestly, I would have hoped for longer, but in a situation like his, this isn't surprising. So comes in, has an abscess now, it's draining, the area feels swollen and it's starting to hurt. What do we do? Well, I don't know that I want a root canal. And what we did do was end up referring him to our specialist. We work with 2 here in San Diego that are going to use the highest level of technology. What is a biologic root canal? Now, is the tooth still dead? Yes, it's dead already. That's why it's abscessed. Is it having a dead tooth in your body bad for you? Yes. But what we're trying to do is get this infection to heal. Antibiotics is not going to make this go away. The area is still going to be soaked in bacteria. So when they go in and a tooth is just starting to die, it has the greatest likelihood of success. A biologic root canal is going to utilize one of 2 different laser technologies so that when they go in, and they're always going to use a 3D x-ray to evaluate the canal anatomy, and the success rate is always on a tooth that's just starting to die. When we start getting into old root canals where the teeth are completely butchered on the inside and also they have been soaked in bacteria for so long, I don't know that that's always the best decision for the tooth. But when a tooth is just starting to die, and this patient's quite young, he's in his 30s, what they do is they go in, they make a little hole in the top of the tooth. And using the 3D cone beam to understand the tooth anatomy, they go in with lasers. And the lasers are going to pulse out and clean out that bacteria in a much more efficient way that gets into these little side canals and other things that traditional root canals will miss. So we use the lasers to clean it out, and then we're going to use ozone to clean the inside of the tooth and try and get some of the ozone up here into the areas that are in the bone where it can try and get the bacteria to start being killed by the ozone itself, and can also go into the tubules of the tooth, clean those areas out that we can't reach with the instrumentation. And the laser again will help us reach those areas that we can't always reach mechanically going into the tooth. So now we've cleaned the tooth out, and it's still not sterile. And we're never going to get to a point of sterility, but it's as clean as it's going to get. And also using the ozone and the laser is going to stimulate healing now. It stimulates the great cells to come in. So the difference also with a biologic root canal is that they're going to use a special type of sealer. It's called a bioceramic sealer, instead of just using the traditional rubber and gutta percha. Remember, traditional root canals that are done this way to this day, including my training 25 years ago, are to use hand instruments to shape the inside of the tooth. Now, we use mechanized ones nowadays, not just by hand when I was old and in school, but we still just go in and we rotor out the inside of the tooth traditionally, and we just soak the tooth in bleach, and then we seal it up with rubber-based materials on the inside. And then the worst part is too, when we go to restore the tooth, that we don't often isolate the tooth with a rubber dam. Most dentists then allow the bacteria to get recontaminated, contaminate the root canal, and then we seal it all in before we put the crown on. So there's a lot of difference in technique with how we do the biologic root canals, and also how we do the crowns that go on top of the tooth, and how we keep the area disinfected and bacteria free. So I hope this helps. I hope it lets patients know there's an option if they don't want to have a tooth extracted, or if they want to try and see if the area can heal on a 3D, if we can get these areas of infection to resolve. And I'm always happy to discuss all of those options when you come on in at Moonlight Beach Dental.